Date, April 15th, 2009. Time, around 2:30 p.m. Place, across the street from the State Capitol Building, Augusta, Maine.
Healthcare expense is a tax. We're not just paying for our own health care when we pay for health insurance. We're not paying just for our own health care when we pay at the doctor and the hospital. The insurance is regulated, so everybody pays pretty much the same amount. And if you do careless things, you smoke, you ride motorcycles off cliffs, you hit your fist against the wall and expect the state to pay for repairs, and I have seen that more than once. There is cost shifting. You are paying not an actuarially fair premium that is based on the likelihood of what you will be paid back for health care. You are also paying additional so that somebody can wave the magic wand and razzle dazzle and hey presto, your money has disappeared. That's a tax. You're paying for somebody else's health care expense. We have to remember that. Whenever somebody says, let's change the health insurance this way, let's change it that way, let's enact this program, let's enact that program, it means that there's an octopus running around grabbing all your pockets at the same time. Don't let him do it. Now thank you. The other thing to remember about the health care tax is that if somebody shows up in the hospital or in the doctor's office and the doctor is on call with the hospital and the patient doesn't have any money, doesn't have any insurance, and is just lost a government job because we've won this thing and tries to commit suicide, neck broken in the intensive care unit and one thing and another, no money. Now who's going to pay? Not the patient. Not the insurance. There isn't any insurance. So the doctors and the hospitals are turned into tax collectors. They raise their prices on everyone else. That's you. You're paying for all that stuff, and if you should be paying, then make them say it's a tax. If they don't dare, then they know it's wrong to make us pay for it as a tax. And if they know it's wrong, they're hypocrites, and we need to say so. Yes. Now let's talk about control of health care. We don't have it. We have the insurance premiums, the taxes, the medical licensure, the medical regulations, HIPAA, the Fool and Dunce Administration, or whatever those people are. They take the money, they give it back to us with the plastic smiles, and then we're supposed to owe them some gratitude. Wouldn't it be just simpler if we had our money and we could buy the health care we needed? Yes. We have to remember that. And without the cost shifting, without the underwriting of the deadbeats, without all the paperwork, without all the regulations, health care would be cheap enough that I don't think we would need that much insurance. Yay! I am so disgusted with the local cost of health care, with the cost shifting and so on, that I tell people, get out of Maine. Go to Antigua. Go to Bombay. Go to Britain. If you go to Britain, the people speak English. I'm not so sure about these other places. But it is cheaper. You have $100,000, you need a coronary artery bypass graft. You buy an airplane, you hire up somebody to take you to Bombay, you come back, you got an airplane. Right? Now let's take a look also. If people do not pay a fair price for their medical care, somebody else pays the excess. Somebody else pays the difference. Somebody is subsidizing it, and that somebody is going to say, that's my money, even though it was taken by force. They're going to say, it's my money, and I'm going to control it. Whereas what we should be saying is, it shouldn't be your money. You took it from us. We want that control back. Many people come to me because they've taken prescriptions and like statins and so on, and they're kind of like poisonous. Statins increase cancer risk. Statins weaken the heart muscle. and the pharmaceutical companies, everything is arranged so that the doctors will simply prescribe more drugs, more painkillers, more everything else, and people will turn down good treatment because it's not covered by insurance. Well, maybe the insurance needs to be reassessed. Maybe these other things should be covered by insurance. And doctors are taught in medical school, the smart people don't get in anymore. The smart people are kind of guided to do something else. They want people in there who are easily pushed around by the drug companies and by the hospital administrators. And the doctor who disagrees with the hospital, who says, I don't think that coronary artery bypass graft is necessary. There's a way to do it without the surgery. The hospital administrators have a right to pester the doctor, threaten his license, interfere with his livelihood, and there are federal laws in place to protect the hospitals from the doctors saying, I don't agree with this, I want to defend myself. So the hospitals control the doctors, and we don't think that's fair. So if you ever see any reference in any House of Representatives bill or any Senate bill that says peer review, we want that peer review ripped out. If hospitals are private, they can make any private arrangements they want to, but a doctor has a right to say, no, my treatment works better than the treatment you're trying to push on everyone else, and I'm going to say so. I am not affiliated with any hospital. So there's nobody out there who is going to try to throw me out of a hospital because I'm not in there to begin with. All right? So any of you hospital administrators, it's not going to work. I'm telling the truth, and you're not going to stop me. And the malpractice insurance companies are in on the scam. And if a treatment, and I'm thinking of a conservative treatment for arteriosclerosis, is out of mainstream medicine, the regular doctors won't do it. The malpractice insurance companies raise the rates on the doctors who do. But the rate of claims is approximately zero. It's a very in-the-money investment to take those doctors as clients. Why? Because the malpractice insurance companies are in the hands of the doctors in organized medicine. The medically organized relying on nonsense. Use the acronym. It works. Now, we've said some bad things about the U.S. government, and we've said some bad things about the British government, but there is one healthcare issue in which I have complete solidarity with the U.S. government. Don't throw tomatoes at me. I'm not finished. Codex Alimentarius. That is an international attempt to take over the nutrition and supplements market worldwide. If the U.S. government surrenders power to the New World Order, then the vitamin C, the vitamin B12, the coenzyme Q10, all of our other favorites will not be legally available. They cannot be prescribed. Germany is pushing this because the German Doomkopfs, or Schweinhunds, or whatever we call them, are trying to corner the market on natural medicine and say, we don't like people buying these things over the counter and undercutting our nutrition-oriented doctors. Well, the Germans can govern themselves any way they please. This is America. And so far, the two major governments that are fighting this and saying we are not going to give in to all of this just happen to be the people we're having tea with, the U.S. government and the British government. All right? Codex Alimentarius, the New World Order, with that former vice president trying to get involved with it. What's his name? Al Gorbachev? Isn't he the one who says something about carbon? He's going to let us breathe in and not breathe out? So I don't have much time. There are people waiting behind me to speak. I do have a website, MainePorcupines.com. Remember? MainePorcupines.com. It's a new website. We don't have any professional web designers, so there are a few misprints here and there. But I want to get the word out. What?
Steaks are good.
That's right. The quill pen is mightier than the sword, and if you don't have a quill pen, use a quill. All right, so A few quick health tips to help you get emancipated from all of this. Diet foods are not, if they are processed to be low in fat, they're high in sugar. If they're processed to be low in sugar, they're high in fat, and the fat is not necessarily healthy fat for you. Stevia is the sweetener of choice. Cholesterol, eat all you want, forget the statins. You reduce the cholesterol. Vytorin was threatened by the FDA because it made hemorrhagic strokes, cancer, dementia. Unpasteurized milk is just as safe as pasteurized milk. It has to pass the same bacterial screening. So, those are big cows. If it's labeled low fat because it's been processed, it's been processed. If it has preservatives in it, the preservatives are intended to interfere with digestion of bacteria and digestion by you. You have indigestion, whatever. Don't eat spreads, don't eat margarine, go with the real butter. Plant a garden, control the chickens, pester the zoning authorities about any agricultural restrictions. Be careful who you give your trust to. If you don't trust a doctor, that's all well and good. No, you can always get a second opinion. You can always get a third opinion. If you don't trust your government, well, here you are. I don't have to tell you what to do. You know it. And don't trust your insurance plans. A bad doctor on the insurance plan can do bad things, and a good doctor not on your insurance plan can help you. Who are you going to believe? The doctor or the insurance people who are trying to take the money and they don't care if you live or die, right?
Disney, is that .org or .com?
.com.
Thank you.
You're welcome, man.
So, and remember, don't trust the government with the warnings, right? They say get vaccines. They don't say that giving vitamin C at the time of the vaccine will reduce the likelihood of adverse effects. But it is in print. Do a search under aapsonline.org for vaccines and vitamin C, and it will turn up for you. If your doctor does not provide the vitamin C and has not heard of the warning, then you should not be trusting the warnings about things that are completely frivolous. All right? The other thing, there are the dimwits in Congress who say, let's switch over to light bulbs and they may have mercury in them. Light bulb breaks, you don't have the antidote for mercury in your house, dimercapto succinic acid 100 milligrams. It's over the counter. You don't need a prescription. You can just plain buy it and keep it handy. Auto body shops, listen up, get that stuff. Auto repair places, listen up, get that stuff. You may need it. You will not find that out from the federal government because they were trying to make us think that alternatives to incandescent light bulbs are completely safe. They're not. So don't trust the warnings. They're being paid to give warnings. They're being paid to withhold warnings. Get the facts from somewhere else. The last point, attention deficit hyperactivity disorder, that is in the pocket of the school systems and in the psychiatrists who are getting paid by having somebody labeled ADHD in the school. How do you prevent ADHD? Two things. One is avoid cognitive dissonance. Make sure that the people in the schools and in the home, there are no mixed messages to the children. When there is cognitive dissonance, the children will learn how to not understand the cognitive dissonance. They will distract themselves and develop attention deficit. If they pay attention, they can reach contradictions. They will not pay attention. They learn that, then it's going to be hard to shake. The other thing, fish oil. The old-fashioned cod liver oil will prevent attention deficit hyperactivity. So cod liver oil and a sensible home and school environment, no ADHD, no nonsense. You don't have to put your children on speed. You don't have to make them into drug addicts. You don't have to give them heart attacks by the age of 20. Right? You go tell those principals that they think Ritalin is such a good idea, make them take it themselves. And if it doesn't kill them, it's going to make them decide real fast that they shouldn't be doing it. All right? So, just remember, choose your health care carefully, overthrow the insurance, think and eat as if your life depends on it. It does. All right, hang in there. Edward Harshman, I know you can't see it, huh?
Will not.